Okay, I'm watching my screen. I don't see any video. It's on? We're good? Okay. All right, Orange County, welcome. This is our back to school special Facebook. You're listening live. I'm your county executive, Steve Neuhaus. I got some really esteemed guests with me. Dr. Irina Gelman to my right, our health commissioner. We didn't bring Brendan Casey back. He didn't get enough likes on Facebook, but he's still working as a commissioner of emergency management. To my left is Bill Hecht, is the chief operating officer for Orange-Ulster BOCES, very close with Orange County. We have a very close working relationship. To his left is Mark Coleman. He is rocking the beard from Duck Dynasty or the Hindu Kush, wherever you want to say. But Mark and I went to Marist College together, and he is the director of operations for Orange-Ulster BOCES. So we're here to answer your questions. So, Doc, do you want to give some opening remarks? And then we'll take some. I'll do some questions. I'll give obviously Mr. Hecht some chance to give some marks, and maybe Mark as well.
Yes, thank you, County Executive Neuhaus. Good evening, everyone. Thank you for joining us for this very important conversation. Tonight, I would like to thank and acknowledge my colleague, Chief Operating Officer William Hecht, whom I've gotten to know especially well in recent months, as we collectively prepared for this difficult challenge of reopening our schools safely. I would also like to thank the families, students, parents, legal guardians, teachers, school staff, school nurses, superintendents, and all of our residents who, despite some differences, are united in their desire to do what is best for our children, their health, mental health, education, and well-being. Since March, when the first case of COVID-19 was confirmed in Orange County, our community has done a fantastic job of collectively flattening the curve. The Orange County Department of Health staff, medical providers, essential workers, and I are all extremely grateful for this monumental accomplishment. Countless men and women who have spent working tirelessly on our local response to this global pandemic are all very grateful. Today, the community-acquired rate of transmission remains low, and it is extremely important to continue to adhere to prevention and safety measures such as social distancing, wearing masks, washing and disinfecting your hands. How we proceed with reopening in the weeks to come will determine if our schools will remain open. It is important to emphasize prevention and safety, not only while school is in session, but also in social settings as we head into Labor Day weekend. We want to do all we can to keep our businesses, schools, and community open and safe. It was difficult enough to close our schools at the height of our local response to this global pandemic, and the last thing anyone wants is to close them again due to an increase in the rate of community-acquired infection. This conversation does not just revolve around students and teachers. This discussion is about all of us contributing to keeping our students, teachers, and communities safe. These are trying times of uncertainty, but this is the time for facts, not fear. This is the time for science, not rumors. This is the time for solidarity, not stigma. Relationships matter, partnerships matter, and people matter. We simply must not supplant facts with opinions as we collectively determine the best way to proceed. I will briefly mention that from a communicable disease perspective, the best way to prevent closing schools again is to prevent COVID-19 cases in our schools and in our community by keeping prevalence low. That can be accomplished by wearing masks, socially distancing, staying home if we are sick, and seeking our doctor. A scientifically based, steadfast, measured approach is what it will take to remain open. So I will go into some of the more interesting and granular level details as the conversation progresses, but it was very important to address that this is not just a school-based issue. This is a community-wide issue. We will discuss masking orders and some of the other safety measures that are currently in place, but it truly is up to each and every one of us to do what is necessary to maintain safety measures. Thank you.
I'd say Doc Gelman and I, from the beginning of the pandemic, we've had a very close relationship with all the school districts. We depend and we lean heavily upon our relationship with BOCES, Orange-Ulster BOCES, to get the message out. We have a very diverse county with a lot of different school districts, and we value that relationship. So from the beginning, Bill Hecht has been our main conduit, along with obviously Mark Coleman and the rest of Bill's command staff. So, Bill, you have any opening remarks?
No, I just want to take the opportunity to certainly thank the county executive and Dr. Gelman for the invitation this evening. I can tell you, since the buildings closed back in March, they have been a key member of our team moving forward. We've had them on virtual meetings with our superintendents. They provided information and guidance as we moved along. And up until this week, I mean, Dr. Gelman was on the call with us and provided us with additional information. It was imperative to reopening of our schools. So it's been a team effort. It's been a collaboration. And together, we've put together strong reopening plans throughout the county. And we appreciate their efforts as well in this endeavor. So, thank you for the invitation to be here this evening as well.
Thank you, Bill. And Mark, do you have any comments? You good?
I just want to reiterate what Bill said. Thank you to Dr. Gelman. Thank you to Steve for all of your support. The school districts certainly appreciate it. We agree with Dr. Gelman that, at least I agree, 3 things: distancing, masks, keep your hands clean, don't touch your face. We stress that. We stress it, and it's so important to keep this thing at bay. And Steve, congratulations too on, we've been with you through your daily calls for municipalities and things, and we watched the rate go from, out of control to really to flatline. And so it's made it now. It's very safe to open schools, which we did today. We'll talk about that later. But it's made it very safe, and just it's so exciting to have kids back today. So, and I don't want to take your thunder, so I'll just leave it at that.
Thank you.
So with that, we have a couple questions. This night is about the viewers, so we do have questions, and a lot of them are probably going to be, this is going to be like speed dating for you, Doc. A lot of questions about science. Why do people have to do this, or what's the policy? So here's the first one. I won't give the name of the person who asked the question, so you can be free to ask whatever you want. What documentation is required for students who are absent due to illness with COVID, like symptoms, or sent home due to illness with symptoms of COVID? Do they need a negative COVID test and doctor note to return to school? According to the Department of Health guidelines, at this time, it appears they do. What about school staff? Do they need to do the same? Please clarify.
So for all staff, students, visitors, any faculty, the guidance from the New York State Department of Health currently has a comma, and this is something that we widely discussed with the superintendents of schools. At the time, the guidance document from the New York State Department of Health dictates that you need a negative COVID-19 test, comma, doctor's note, and to be symptom-free and to be clear. Our FAQ document, and it is available online. This is a document that was sent out with all of the schools. I'm holding it in my hand. We basically answer that question fairly concisely. There will be a clearance from your medical provider. So that clearance from your primary care provider, first and foremost, before anything else, or COVID-19 negative test. The New York State Department of Health, in our conversations and our extensive conversations with them, have assured us that they will be releasing an updated guidance documents for pre-K and grade 12 to update that to state whether it's a COVID-19 negative test or a medical note, but first and foremost, a medical clearance, just like with any other communicable disease or any other medical condition, outlining the safety parameters of that individual, whether staff member, faculty, or student, to return back into a congregate setting environment, of course, keeping them safe and all individuals around them safe.
And just, I wanted to mention this to the public. So Dr. Gelman, her husband and her have children in Orange County. I have children in the Orange County community. I have chosen to keep my kids home. Dr. Gelman has chosen to send her kids to school. So a lot of this comes down to your personal circumstances. Can you stay home with your child? I thankfully can in my situation, not me personally, but my wife's home with our children. But some people can't stay home. So that will also help determine your choice and if you feel safe and so on and so forth. So I just want people to know that we are having these conversations ourselves as colleagues as we go through this.
And I will mention that having 3 children, one being a teenager who's 15, the other one 8, and a 6-year-old, completely different parameters as far as keeping their masks on and difficulties where a teenager may be able to keep a mask on, but may not want to necessarily. The coolness factor is not there. And for a 6-year-old, not necessarily even being able to keep a mask on. But we have been running something comparable to a boot camp in our household for hand washing, keeping your distance, and actually retaining and maintaining that masking requirement where they're keeping it on for a couple of hours a day, where they're getting acclimated to even getting comfortable wearing a mask.
So we're going to answer, and we're going to go into this, guys, because there's follow-up questions. Okay, so now what's going to happen when a sick kid that stays home has to come back? He gets tested, he's positive. Are they going to take his temperature at the school?
The child who's going to come back who's tested positive will technically be under mandatory quarantine for a duration of a 10-day clearance or 3 days asymptomatic, and they will need that medical doctor's note for clearance to even return back to school.
So when they return back, do they have to get their temperature taken?
Well, that's going to be a school-by-school basis. Each school is making their own, it's in their plan, in their reopening plan, just like we have. But what we have chosen to do at BOCES, I can only speak for us, is we have installed temperature sensing stations. So when you enter into one of our facilities, your temperature is taken automatically, and if you pop over 100 degrees on the screen, we have nursing staff. They'll pull you aside just to double check you, because sometimes if you come from outside, you might bring the heat with you, or the whole host of factors. So we double check you, and then if the nursing staff determines you are in fact over 100 degrees, they'll go.
But I think that question goes more to the fact of whether or not they will be excluded from any other criteria, such as being symptomatic later on and having to go home, or any other requirements just by virtue of testing positive for COVID-19 previously. That will not exclude you for any other parameters, because we have had a small handful of residents that have consistently and persistently tested positive for COVID-19, meaning that they have tested positive, and weeks and even months in some instances later on, they did continue to test positive. We've also had a very small handful of residents that have tested positive early on, back in March and April, and now have tested positive yet again. Because we are still, that's a major unknown currently as far as antibodies, circulating immunity, long-term immunity, and what actually happens after secondary exposure. Because those variables are yet unknown, and we are seeing preliminary literature come out globally to show that there is a reinfection, a small rate of currently reinfection, so secondary infection rate, where they will not be excluded, so they will still be sent home, and they will require the same medical clearance as anyone else.
Right. I might add that, daily we do a questionnaire for our students and our staff. All right, so that's something we do daily, just in terms of the symptoms and conditions that the individual is under.
Correct.
We also, as you said, we check temperatures on the way in every day. So those are things that's done in our facilities every day.
Correct.
So just going to BOCES for a second, today was your first day back to school. How did it go, guys?
It was awesome. I can't, what I saw, we prepared. We prepared for months for this day, and it was just awesome. I observed buses rolling in, or we had, certainly our staff was in for superintendent's conference days on the 1st and 2nd. Today, we welcome students back. Buses rolled up. They were socially distanced on the buses. They got off with masks. And it was just amazing to hear conversations and laughter. It's something that we needed to do. Certainly the student population that we deal with, they've been out of school, in school buildings for quite some time, since March. And it was time to bring them back, and today we achieved that. Mark, I don't know if you, go ahead.
I will share with you, I got emotional. I was in the building and saw teaching staff walking in with children who had masks on, and they were explaining to them that, we're going to walk in the main lobby, and there's a little panda bear shaped camera up there. It's going to take your temperature to make sure that you don't have a fever. And then we're going to walk to class. We have to stay on the right side of the hallway. We have tape that divides our hallway and arrows showing you which direction to go in. And I lost it because the emotion of, I think, the past 5 months, coupled with all the hard work that our team accomplished at BOCES, and just the plan and the planning and the preparation, it kind of all hit me at once. And then I came to see Bill and Deborah Heppis actually after that, and made them cry as well. It's okay.
I'm fine.
But
It's been a tough road.
it's been a tough road. But what a joyous thing to see these kids, especially the special needs kids. They need this, And I just bought a water at the store up the road, and the woman saw my badge. She said, "You guys open today?" I said, "Yes, we did." She goes, "That's great." I said, "Yeah." I said, "We have especially our special needs kids. They really need this." She said, "You are 100% right." Because they do. They need the therapies. They need the personal
But we
contact.
follow the protocols.
Absolutely.
People were masked. They were
Absolutely.
socially distanced. I observed meetings outside where our staff was socially distanced and following the protocols, following the rules. And that's what's going to keep us, from spreading this thing. And it's important that everybody understands that. These plans and these protocols are in place for a reason. And, we rely on certainly you to provide us with that guidance. And that has worked into our plan. And it was just, again, I go back to, it was an awesome day. It was truly.
It really was.
Yeah.
It really was.
I think we kind of covered this, but it's going to keep coming up in different forms of questions. Can you walk us through exactly what happens when a student in my child's class or on the bus tests positive for COVID-19? And Dr. Gelman looks like she's cramming for a final exam. The rest of us, I have like a notepad, 2 pieces of paper, and 2 laptops. But Doc, do you want to, I think you kind of covered it a little bit before.
So I will go over the basics, but I will refer back to that FAQ that we've released where, very specific with the school scenarios. There are various school scenarios that are covered, travel related, testing related, other scenarios as far as classrooms, bus settings, what happens with exposure within the household, an individual who tests positive, an individual who is a direct or a proximal contact. So we go through quite a bit. We actually cover a lot of ground in our Orange County Department of Health pre-K through 12 grade guidance document. But as far as the basics, so if there is a student in the child's class or on the bus testing positive, first and foremost, contact information for all direct and proximal contacts will be collected. The individual's personal, so that individual person who has tested positive, we would never release the information of any individual person. So any individual or cluster of persons or any personally identifiable information would never be released. Just like with any other communicable disease, we cover over 60 communicable diseases that are mandatorily reported. We would never release that information to the public or anyone else. With that said, the individual's name would not be released. However, that list of contacts that I referred to early on would be contacted directly for communicable disease investigation. Once we've conducted our preliminary communicable disease investigation, we would then go on to contact tracing. So those individuals that are on the contact tracing list would be contacted, whether by the Orange County Department of Health or the New York State Department of Health. And once we have contacted the potentially exposed individuals and either direct them to quarantine or monitor for symptoms or both, in the event that there is no concrete list or contact information for those individuals that may have been exposed with that particular scenario, there is always a public health alert that will go out, or that particular school or school district would notify the classroom, the bus, or what that scenario entails. So that's kind of the general parameters. More granular level data is available in that guidance FAQ document that's on our Orange County Department of Health website, on our Orange County Department of Health Facebook page. It's also available on the Orange County, New York Health app. It's a free app that's available on all platforms, and it does cover that document in a tremendous amount of detail.
Okay.
If I could add something real quick to that. Yeah. So in order to help contact trace, so everybody understands what BOCES is doing is every room has a sheet, a contact trace form. So everyone who enters that room logs that, puts their name and the time in and a timeout. So everyone who has contact with that room. So in the event someone does have symptoms of COVID or you need the information, we're going to be able to provide that to you. So that's how we're handling it, and we are filing that every day and cataloging it. So there's an extensive amount of work that goes on in the background in the event that something does happen. So that's what we're doing.
Mm-hmm. So I said this is going to be like speed dating, so we're going to go through a lot of things quick. So what are school districts doing to ensure that school buses are sanitized every day? Anybody know, I know everybody has their own plan, but is there a general rule that we know what's going on?
I mean,
well, there is information in the guidance about sanitizing buses, but we don't have buses at BOCES, so it's a weaker topic for us.
Right.
But we do know that from what we understand from our school districts is that they are sanitizing the buses at least daily, if not more. Mm-hmm. I've seen some of the operations in some of the school districts when COVID was just becoming a thing, and districts really started to take seriously that, hey, something's coming down the road. And I saw, districts were hiring bus drivers to stay during the day, and they were cleaning buses, they were sanitizing them. So I know that's going on. I know
it's district by district.
district by district, because everybody runs their
And
own.
the same thing would be another follow-up question someone else answered is what type of HVAC adjustments to that school bus are being made? So,
Well, I believe the recommendations say they recommend to open the windows, because a lot of school buses don't have air conditioning. So correct me if I'm wrong, but I believe they recommend windows being open to help circulate air.
And that's typically a question that's brought up as far as adequate ventilation. And I will say the foundation, the first and foremost safety factor is that mask. The reason we wear masks is not to meet a criteria to be able to get into a store or to be able to just meet the bare minimum to get into a school. The real reason and the premise for it is for droplet containment. You want to contain those droplets because if there are any viral particles in those droplets, and majority of individuals, as we know, 80% may be mildly symptomatic, they may be pre-symptomatic. Unfortunately, with COVID-19 specifically, unlike SARS, there were elements of this infection that were unexpected if you were to compare COVID with SARS. With SARS, the amount of virus in the person's mouth and nose and body increases steadily for the first week or 10 days after infection. So with SARS, which is related to COVID, you have a smaller viral burden and it keeps progressively increasing as the infection progresses. With COVID, it's the opposite. That highest viral burden is highest just before people are actively symptomatic or before they actually feel sick. Then that decreases steadily as time goes on and as you have progression with the disease. That's the entire premise to actually wearing those masks, because you have the droplet precaution and you need to contain those droplets in order for them not to land on those surfaces in the first place or not to be propelled to that individual sitting across from you. So I think that's an important point of distinction, where if you have an individual and you couple the fact that that viral burden early on, you have individuals 18 to 44, which are the predominant mode of transmission to this day. We've had the highest amount of cases in the individuals 18 to 44 years of age, and all of our active cases right now, majority of them, I would say, are 18 to 44 years of age. So when you couple that early viral burden of disease with the fact that 80% will not show symptoms early on, and individuals typically say asymptomatic transmission, you tend not to remember having a headache 2 weeks prior to, so you still have mild symptomatology, you just don't recall necessarily having quote-unquote symptoms. So when you couple the 80% mildly symptomatic, and our data reflects that locally, statewide, and nationally, when you couple the 80% mildly symptomatic where they don't know whether or not they have that disease, you have the 18 to 44 as that primary vector for transmission, and that early highest viral burden, that truly creates a perfect storm as far as that potential for propagation. So it is imperative as a first line of safety to wear a mask and wash your hands.
And by the way, Doc, we have these two gentlemen are wearing masks. You and I aren't. That's been a couple of comments. Now you and I are far enough away from each other.
We are far enough away, so it's two arms length if we stretch out. But more importantly, I just recently had a COVID test, so I did have a negative test literally before walking in. So far so good, and I just removed it because I had my own medical procedure recently, so I am able to speak. But I did have a negative COVID test as far as masking.
Just to follow up with the buses, I know, just in terms of observations, all of the drivers that we saw on campus today were wearing masks. And I even saw one after students were off just wiping down some surfaces. Now, I'm sure once they get back to the barn, they're cleaned thoroughly.
True.
But they were taking additional protocols that...
And I will mention in general, as far as just HVAC and that mode of transmission, I know there's a tremendous discussion about aerosolization of particles versus actual true airborne transmission. And without getting into the R0 factor and the transmission rates and what the true differences are, fundamentally speaking, this is still predominantly a droplet precaution disease. Yes, we worry about aerosolization of droplets. That's why we're discussing different activities based on that wide spectrum of risk levels associated with them. So if you're speaking and forcefully projecting out, if you're singing, singing, if you're exercising and you're forcefully expelling those droplets, there's that potential for aerosolization. We discussed restrooms, and my particular area of importance, restrooms where individuals tend to congregate, they may potentially remove their masks, and first and foremost, hand dryers. So before we discuss kind of HVAC or any ventilation systems, adequate ventilation does not just mean filtration systems and the microns involved in that. It really means doing everything possible not to aerosolize droplets, because despite the fact that early on Johns Hopkins mentioned airborne transmission, this virus does not have a true airborne transmission potential. So for instance, the measles, for every individual that has the measles, 9 individuals will get infected if they're not immune to it. With COVID-19, you have about 2 to 3 individuals. So that's that R0 factor that we discussed, the transmission factor. With the common flu, it's 1. So the R0 value for the common flu is about 1. For every 1 individual that has the flu, 1 will get it. For COVID, for every 1 individual that has it, 2 to 3 will get it. With measles, which is a true airborne transmission, you can expect individuals in a room, for every 1 person that has the measles, 9 will get the measles. That's a true airborne transmission. With COVID-19, we worry more about aerosolization of particles. And just circling back very briefly to that discussion about masks, with masks, it's imperative to wear the proper mask. So if you're wearing a surgical mask, if you're wearing a cloth mask, and I do have one in the bag with me, storage is extremely important. So you want to make sure you're isolating it and keeping contaminated surfaces out. But once you have a cloth mask, the type of material is going to be very important, because any material that's thin enough, it will actually be counterproductive, because it will tend to break those particles apart. And I know there's a lot of conversation going back and forth. Well, what about a face shield? Face shield is great if you're still wearing a mask underneath. A face shield will not substitute for a mask. Whether face shield or mask, you have to wear a mask first and foremost. Those masks with air filters or ports or anything on the sides are absolutely not allowed. There are various studies out of Duke in Science Advances as far as gaiters and those bandanas. Those bandanas and gaiters are not ideal. Are they better than nothing? That is truly more dependent on the material type. So if that material type is fairly thin and it will allow for those particles to seep through, what it will actually tend to do, rather than contain, that material has to be able to contain droplets. What are we trying to do? We're attempting to contain droplets so they're not going around the areas around us. If that material allows for that seep through and breaks those particles apart, now they're smaller, they have more of a tendency to linger in the air. The heavier droplets fall down thanks to gravity.
If it's a heavier bandana, that would be acceptable.
Yes and no, because you really want that adequate coverage for the nose and mouth. In order to contain secretions from your mouth, you want something to cover your chin. So gaiters and bandanas are not ideal, first of all, depending on the cloth material that they're made from, but more importantly because they don't adequately cover the chin, so you're not actually containing anything. For anyone that's worn them, we know that particles may end up actually on your clothing, and just keep in mind contaminated surfaces. We don't want to touch contaminated surfaces and be able to touch everything else. It's really, that's the underlying premise to why we are doing it. We want to contain those droplets adequately.
Well, I'm glad she brought that up, Dr. Gelman, because I think the important points that I want to just stress real quick. Mouth and nose. So early on, face coverings required were the signage you saw everywhere. We started early on. I said, this isn't going to work because people are wearing their masks below their nose. So we said, and now I think everybody's doing it. We didn't lead it, of course, but cover your mouth and your nose for it to be effective. So that's important. And then the valves, that's actually in the CDC. Is it CDC? I think it was CDC. They are actually coming out now. It's very explicit about the valves in the mask. So
one of the things that we did
points.
as part of our reopening process was you sent out vital information through flyers.
Correct.
How to correctly put on the mask. It needs to cover the nose and the mouth.
And this is going to be an issue because kids are going to come in with their own masks, the teachers, staff, and you got to be uniform to make sure that at least they're effective. And I think every district, as well as the county, has been giving masks out for the last 6 months. So there should be no excuse that everybody has, or your child will be at least offered the proper mask.
Well, early on, we were at a food delivery station in Goshen, and we were handing out masks.
In the early days.
Early days,
So, 60 over 2/3 of New Yorkers believe that that are really nervous about going back to school. It's a Siena poll that came out yesterday. 2/3 are against fully opening schools, and we all know that, and that's our audience right now. We have, in the last 7 days, the headline that everybody's reading is that colleges are having spikes all over. We have a cluster at Westchester today. We had with the governor's office. We had a cluster starting at New Paltz. We have Oneonta shut down in the last 2 days. They have over 400 cases. They're now closed for the semester. Now, those students are being tested. Our students are not being tested. Are we worried about a prognosis going forward where schools will be shut down?
I'm going to say, in those cases, if you read the articles, they weren't following the protocols.
They had a big party at Oneonta.
They had a party.
Yeah.
They weren't social distancing. They weren't wearing masks. I don't see that being an issue necessarily in the schools if we're doing what we need to do. Certainly, I'd refer back to Dr. Gelman in terms of.
So that's a very interesting question because it is really a two-pronged answer. As schools reopen, we will encounter cases.
And we have these conversations. So Doc and I talk as a father and a mother, and I say, well, if you're sending your kids back, are we going to be experiencing this? Is your kid's school going to be shut down for 14 days? Are you and your husband going to have to make alternative plans?
Yes. So the reality is, as schools reopen, we will encounter cases. That's just the basic reality of it. We plan to evaluate every situation closely. Obviously, we will balance the desire to keep the school open safely while still protecting the public health of the individuals there, staff, faculty, students, and everyone alike. But the reality is this will depend on the rate of propagation within the community as well. Because once you have a certain degree, and we do address that again in that FAQ document as far as threshold. What would that threshold for community-acquired transmission be in order to close down a school? Because remember, it's not just the school is not, it's only one facet of our society. We still function as a community. And currently, we are enjoying those low rates of prevalence overall of disease because we're under 1%, thankfully. So far, so good. But as we go on into the fall and then into the winter, what generally speaking in the scientific community, that anticipated COVID-19 second wave, that will be dependent on community-acquired transmission. So once we start seeing higher rates of community-acquired transmission, it's fairly certain a matter of time once we start seeing cases, whether sporadically or not, within the classes. So the reality is, yes, we are trying to put every safety measure in place, but once we start seeing the higher rate of prevalence within the community, the reality is that there is quite a substantial potential that either classes or school districts or all of our schools may potentially close in the fall. And just discussing the potential of a quote-unquote twindemic where, unfortunately, the second time around, that potential second wave will coincide with flu season. So that conversation is not a separate topic of discussion because those complications from the flu will coincide with those potential complications of the total amount of cases that we will see for COVID-19. And that's definitely something we want to avoid, and we urge everyone to receive their
flu vaccine.
vaccine.
I think Mr. Coleman said that's why there's such a heavy thing on contact tracing. Who's in that room that day so you can find out who possibly could have been exposed. Just a follow-up question for any one of you guys on that. What is the threshold for the state of New York with the colleges? If 5% test positive, they have to stop for the semester. What is the threshold for here if we have a
9%?
9%.
So that threshold is 9%, but don't forget that locally we can always trace certain clusters, and as clusters develop and they really combine into a larger outbreak, there is that potential of closing down not necessarily just schools where those sporadic clusterings are occurring, but also closing down school districts because we have those specific rates. We're able to do that locally. That's why locally we can always be a little more conservative than state. However, if we're seeing that broad, wide community-acquired transmission, that threshold is 9%, and that, again, is in the FAQ document.
I'm going to add that you had a number of schools in those college communities. The public schools were looking to open, and where you had those breakouts, they had to change their plans overnight and now have to go remote just to contain what's happening in those communities. So
I think it's important too, this keeps me up at night because I'm sure all of us have been up at night during this whole thing. But I wake up at night, and I know my colleagues do, and think about what didn't we think about? That's why the guidance has been so important from the Department of Health and the CDC and from the State Education Department. But Dr. Gelman mentioned earlier social settings. and spread there. So, this isn't over yet. We're in a good place, but it's not over yet. So I think it's really important. And I tell everybody I know that, if you're going to weddings and parties and things on the weekend, Labor Day weekend, and then you're coming back to work next week, so now we could have a problem. So it's really important for everybody to just be responsible still, hopefully for just a little bit longer, and try to maintain a small,
Especially true as we're heading into Labor Day weekend, and I guess along the same vein, travel-related quarantine. I cannot emphasize this enough, despite the fact that the CDC guidelines may vacillate or have changed recently as far as travel-related quarantine. International travel has not changed. Those parameters are still 14-day quarantine requirement, and any travel to those states with the high rates of prevalence right now of COVID-19 still mandate a 14-day quarantine, whether that's for staff, for students, for volunteers, or for anyone else alike. It's extremely important to note the travel-related aspect, and also if you are in the process of being tested for COVID-19, if you have not received that test back as of yet, it is not only prudent, but it is imperative to remain at home at least until receiving that negative diagnosis. But more importantly, that negative laboratory result does not necessarily mean that will excuse you for the remainder of that 14-day quarantine period.
I just want to add, that you talk about that travel advisory ban. That's one of our questions in terms of our questionnaire, our daily health screen.
Correct.
But for the parents out there, we need you on board as well to work with us. So before you send your child to school each day, do that check for temperature, check for signs. We're going to check certainly through temperatures when they come to school, but we need your help as well. We need to work in partnership so that we can certainly curtail this. And
so on that topic, a lot of questions are coming in. Temperature is not the only way to gauge this thing.
That's correct.
What kind of screening is done? Like, some offices, when you come in there, they say, have you been sick? Have you been exposed? And so on and so forth. And they do the temperature check. Are we relying on parents? That's a big piece. That's why we're emphasizing that with parents. It's they know their children the best, and they'll know when they're not feeling well, and when that they've seen changes in them. So we just need them to monitor and work with us. And if they exhibit some of those symptoms, they need to keep them home until we know for sure and they know for sure. That the child is back to being well. So
we held several town halls online and had hundreds and hundreds of people for our staff and our parent students, and stressed that it's really important for both staff and students to do the right thing. Staff is required daily to answer a questionnaire which asks about any symptoms. You have a temperature. Have you had a temperature? Have you been exposed to anyone with COVID in the past 14 days? Have you traveled out of state to one of the states in the governor's order? So we ask those questions of staff every day. We also ask that of students every day. Although the guidance doesn't really require it every day of students, we still ask that our students, the parents of the students, do it every day. We really want to be conservative with this. We really want to be tight with the process, because it's that important that everybody think about those questions. Think about, oh, maybe I should check if he has a temperature. Have we been out of state? Oh yeah, we were around this one. So we just feel all of these steps that have been put into place, even some of them we're going a little beyond at BOCES. Sure. We just think it's that important. And Dr. Gelman, obviously, everything she's saying just brings it home for me and confirms that we're doing the right thing. So I'm really pleased with.
So this might be more of an opinion, but somebody says, do you think it would be wise that students and faculty get checked before school starts?
Certainly schools don't have the authority to do that kind of testing. We rely on the county and our partnership with you. You've published sites. So if we do have someone who is exhibiting symptoms, they can go to the doctor. That's the first thing we tell them. Please go to your doctor. And then they can get tested. But there are sites that parents can go to as well, I believe, to have that testing.
Yeah, so as far as testing sites, those are available, but the most important premise to this, and I will revert always back to the primary care treating provider, because it is imperative for that primary treating provider to really play that pivotal role in that determination. The first line of defense, of course, would be the nurses, the school nurses, as far as screening for those potential symptoms, but any individual that is exhibiting active symptoms would more than likely be either sent home, or should remain at home to begin with. That would be the ideal scenario, but will be sent sent home. And then it is up to the treating provider, because that treating provider will know best if that individual is exhibiting symptoms of seasonal allergies because they have them flare up every single October, or they're in fact potentially symptomatic, whether that's for the flu or for COVID-19. So primary care provider will play a fundamental role in that. As far as testing that is available, so the state-ran test sites, that's free testing that is available. There is ample testing available through our federally qualified health centers, and I believe that's on a sliding fee scale for those that are uninsured or underinsured. And the list of all test sites, again, I will refer back to that FAQ that we have released that is online. All of the schools have received it, but it is also available on our Orange County Department of Health website and on our free app. We have a running list of all the test sites that are available throughout the county to receive that test. That negative test is not necessarily just completely excludes the diagnosis of COVID-19, because as I have mentioned previously, a negative test at one point in time may not preclude you from actually having to still stay and monitor for symptoms for that duration of the 14-day quarantine, because that 14-day quarantine period is based on the actual period of time where you can actively incubate the virus. So if you were exposed, that 2 to 14-day period of time is you can incubate that virus at any given point. If you happen to test early in that continuum, you may not test positive early on. So testing, yes, that's a great tool. However, in the absence of a primary care provider, it does not tell us much clinically.
One parent wrote, I'm getting a lot of people talking about staying home. If my school does not offer virtual, if I want to stay home, am I going to be penalized by educating my child at home?
Do we have any schools that do not offer virtual options?
I believe
Everybody should be doing a virtual option, at least a public school.
Or a hybrid or virtual, yeah.
Or a hybrid. The other question, let's keep going through here right now. Dr. Gelman, is it true if you get the flu vaccine, it lowers your chances of getting COVID?
It's not necessarily true, because remember, we're talking about completely different strains, viral strains, but it does obviously decrease your chances of getting the flu. It can be more or less ruled out for the most part. Can you have co-infection? Yes. Can you still be infected with the flu even after vaccine? Yes. But it does actually increase your immunity to the flu and decrease the potential for complications of the flu. Because keep in mind that this is a novel virus, and a lot of factors still remain unknown. Predominantly, what happens post-secondary infection. So if you were infected with COVID-19, can you get COVID-19 again? Yes, potentially, and we don't know that potential for long-term immunity, circulating immunity, how long you have it. So antibodies, that's very questionable. That's why antibody testing does not have a very high degree of clinical correlation or diagnosis. And also, what happens as far as long-term sequelae and complications? We're just now reading about long-term potential complications that individuals are experiencing after COVID-19 infection. So flu vaccination, absolutely, like no other year, even if you do not get the flu vaccine any other year, just for the purposes of avoiding a twindemic that we may potentially experience, please, as early as you can, get your flu vaccine just this year, please.
So, Doc, going back to you guys, one school district they said does not offer it. I'll just say it. One of the parents said Cornwall School District does not offer virtual. If they didn't offer virtual and your kids are there and they wanted to stay home,
I would have them my advice would be to contact the school district. And
by the way, if anybody's on here, I got a ton, hundreds of questions coming through here. If we don't get to you, and I plan on staying as long as you guys want to stay with me here, because this is important stuff, and that's why I'm not cutting anybody off with the questions. I can't give you a quick rapid-fire answer.
My indication is that Cornwall's using a hybrid model.
Okay.
Tells me that that's.
But if they don't, anybody can message me here. Mm-hmm. Just put a privately message, so you don't. If you want to have a private question, it's about you individually, your child. We will send it. We will get back to you like we do with the other stuff. I'm going to keep rolling through here. What, Dr. Gelman, describe what is a mask break?
So as far as a mask break, and this is something that is explicitly mentioned in the order that we have issued, Commissioner Order on mandatory masks on buses and in classrooms, we've explicitly noted that those allotted mask breaks, it's important, and that mask break is by no means is a way of circumventing the Commissioner Order, because going back to our earlier discussion, we have to remember the reason why we are doing this. This is not an exercise in futility by any means, and we can go into sort of the premise and the reason for why experts are currently concerned. And this is regardless of your own personal take on what the pandemic means, what COVID-19 means. But generally speaking, a mask break has to take place in a very well ventilated area with maximum amount of social distancing available. Because again, remember the reason why we're wearing the mask in the first place, to contain those droplets and truly contain that potential for propagation of disease in an individual that may be mildly symptomatic at the time and maybe potentially have the highest viral burden at the time, and really be responsible for a super spreader event. Because once that happens, that school will close down. So it's imperative when we are taking mask breaks, just because they are allowable, that's something for that staff member, student, volunteer, just to be able to take a little breather. Obviously, if they're eating a meal and if they're sitting down and then they're stationary, they're not really moving around, they're not mobile, they're able to eat their meal. Obviously, they need to remove that mask. And I will just briefly mention, obviously, storing the mask properly and isolating it. If that mask is contaminated, if you're not storing it properly, if you're not washing it daily, it defeats, again, the entire purpose of having that mask. And you need to wash your hands, or at least sanitize with 60% alcohol-based sanitizer, or any sanitizer with an active ingredient that's able to decontaminate your hands prior to donning that mask and after taking it off, and again, storing it separately, because I have seen these masks all over and they're just used pretty much as a check mark to get into a store or sort of a means to an end. We really have to understand why we are doing this. We are doing this to truly remain open, because although you may use that mask break as a means of getting out of the Commissioner orders for even wearing a mask, the more frequent those masks are, and the longer the duration with your mask off, that time with the mask off, in a congregate setting environment, the higher the potential of transmission in that environment. And none of us want to contribute to a super spreader event, or to allow for your classroom to shut down, or to take time off for an entire school. So we are doing this as a collective effort to prevent any of that from happening.
So, Dr. Gelman, you talked about cleaning daily. So, if you're not doing that, and say you have a cold, would that perpetuate that cold in terms of the germs that are with, it doesn't have to be COVID.
Yes, absolutely. And not only that, again, remember, if you're donning that mask, so there's that internal surface, which is your own germs, and you are, of course, concentrating them if you are not cleaning that daily and properly, just like with any undergarment. But also, ultimately, keep in mind that contaminated surface. If you're using it interchangeably, inside out, upside, right side up, and you're touching that surface, that then becomes a fomite that is a magnet for contaminants, and it defeats the whole purpose. If anything, it's counterproductive, because now you're concentrating that contaminant as you're coming across more and more individuals. You're concentrating that contaminant on the surface, and then you're touching it, you're spreading it as you're moving along. So just be cognizant of the reasons why we are doing it. And I assure you, it is not an exercise in futility. I do want to get to more questions, but we can actually discuss the premise of why experts are concerned, what that potential of the COVID-19 second wave looks like. There is a fundamental, a historical, and a communicable disease actual fundamental basis for thinking that there will be a secondary COVID-19 wave. And we will get into that discussion a little later on.
So, Mark Coleman, this one's for you. Can you address MERV 13? That's specific for you.
MERV, I mean, it's specific for me. That's interesting. So
I don't know why you, but
really, okay. So
unless anybody else wants to jump
I'm sure, Doc. I mean, we'll talk about it. But MERV is a filter rating, right? So it's the denseness of the filter, really, to be able to catch particulates. So it goes from, low density to HEPA and surgical and all that. So up to 20. There's a lot of hype about MERV 13. frankly. But frankly, I think more important is the airflow, right? So what happens when you put a filter that, like a MERV 13 or higher, in a ventilation system that it's not designed for, it won't allow the airflow. And state ed is very specific with respect to ventilation in schools. The engineers have to approve every ventilation project for schools. And what they look for is about 15 CFM per occupant or rated occupant per hour. And when you put a MERV 13 filter, and you could be lowering that rate of air exchange, which could make the virus hang longer than it should. And in fact, there's been a bunch of engineering studies about the effectiveness of MERV 13, et cetera, et cetera. So basically, a lot of hype. The governor did require it in malls. That's it. He didn't require it anywhere else.
But even for everywhere else, and I will kind of break this down a little bit, we are discussing the actual size of that viral particle, and that goes to the microns, and of course the filters really pertain to that filtration possibility based on the micron size of that viral particle. Ultimately, again, the reason that why we mentioned droplet precaution versus what I've originally mentioned as a true airborne transmission is the size of that particle. The smaller the particulate matter, obviously the longer the possibility it can linger in air and the further you can project it out. That was the premise and the reason under actually having that wide spectrum of risk-based activity. So obviously an individual who's in a choir, let's say, is forcefully expelling those droplets. They tend to be heavier droplets at the beginning, and of course due to gravity they're falling down. If they are propelled forcefully out, so if you're singing, if you're in a gym environment, so are we against youth sports? Absolutely not. Are we against the gym? No, absolutely not. But the reason we are discussing this and why we need to mask and really contain those particles, so before even getting to the filtration system and airflow, it's really important to address that containment portion, because you do have viruses that are highly labile exogenously, meaning they will live for a very long time outside the body. They're very tiny. They will linger in the air and on inanimate objects or surfaces such as fomites. So for instance, hepatitis has a very long longevity exogenously. COVID-19 does not fit into that description because that initial viral particle tends to be a lot heavier. And as you're having that true droplet precaution, as we're spitting and as it's a projectile, gravity tends to take care of majority of those droplets. So before we get to the filter, I think it's imperative to really discuss the primary prevention measure, which is what we are currently discussing as far as masking, washing hands, and proper airflow in general. Because once we start addressing this in a manner where we're putting in fans or any other, as we spoke about, hand dryer or anything with that potential to aerosolize that larger particle into smaller particles, as we're aerosolizing and breaking them down, again, back to the discussion of the cloth and anything that is thin enough to allow for that particle to break apart and sift through into smaller and break down into smaller particles. It then allows it to propel further and linger longer. So again, reasoning for why we're doing a lot of these things. Filtration, secondary measure. Primary is masking, containment, and washing hands.
All right, let's keep rolling. Pre-K kids, masks, no masks?
So anyone over the age of 2 or medically able to tolerate a mask obviously should wear a mask. Having 3 children myself, I understand the difficulties involved in that. So clearly socially distancing as far as possible, and masks for as long as that individual can maintain wearing that mask, because again, especially with younger individuals, that they tend to be a reservoir for all sorts of infection, not just COVID-19. So it is imperative, again, for those containment efforts to have them wear a mask.
So this is another discussion. I'll just keep rolling with it. There's a lot of great comments on here. Some person just said, why are colleges 5% and our schools 9% for the threshold to shut them down? And that's a great question, and I agree with her. But here's a couple quick ones. Flu transmission, the general flu should be down if people are doing this too this year, right? Like the number of people that that contract the flu if everybody's wearing a mask?
Good question.
One can hope
Okay.
truly, but again, the distinction between COVID-19 and the flu. I know this has been a broadly discussed topic with why the flu, why are we not as concerned with the flu, and why are we so concerned with COVID-19. COVID-19. 80% of our cases locally, and I can go into the granular level statistics, but I will not at this point, but we may discuss it later on. 80% of all of the cases that we have had mild presentation and mild symptomatology. We have had both locally, statewide, nationwide, and globally a very consistent 13 to 15% complication and hospitalization percentage. That's a very important number because don't forget, the flu happens in larger numbers, but a much smaller percentage of complication and hospitalization, and that percentage is 0.01. And that happens over a much longer flu season, which happens to be, the duration could be anywhere up to 6 months. So we're seeing more cases, a lot smaller rate of complication and hospitalizations over a much longer period of time. The issue with COVID-19, and I will keep insisting on this particular explanation of it, not the symptomatology or anything else. With COVID-19, we have a consistent 13 to 15% rate of complications and hospitalizations. That's both out of the total amount of cases to date. That's a steady rate of hospitalizations and complications, as well as, ironically enough, the currently low disease burden that we are experiencing in the community. So currently we have 127 active cases in Orange County. Of those 130 or so cases in Orange County that are active, that rate of 13 to 15% hospitalization and complications have remained consistent, where you will find that same complication rate. That happens over a much shorter period of time, which tended to be the issue all along, where when you take the 11,494 cases that we have had to date, when you take 14% of that over a period of 6 to 7 to 8 weeks, that presents an issue with resources and capacity. We have a limited amount of hospital beds, of first responders, of more capacity, so on and so forth, nursing homes, rehabilitation centers, staffing, as well as resources themselves, testing, supplies, PPE. So when you have that tidal wave of cases coming across, that's essentially something we want to make sure we're preventing. And now as we're heading into flu season on top, one can hope that that's the case, where individuals will adhere to the safety plans. They will actually take the necessary precautions and properly disinfect hands, properly wear the masks to decrease both the rate of complication from the flu and from COVID-19. However, those are very distinct differences. Mortality percentage for COVID-19, 3 to 4%. Very consistent locally, statewide, nationwide, as well as globally. With the flu, that is not the case. That is 0.001 as far as mortality rate percentages. Obviously, bigger total number over a longer period of time with a smaller complication, hospitalization, and mortality percentage. So that's a distinct difference. We can hope that it will also decrease the flu. However, we're more concerned with confounding the effect of.
A lot of parents from Cornwall saying that it's you can't be remote unless you have a medical documentation. So that might be something that we might need to talk about offline with these parents and maybe advocate for a second.
I would encourage those parents to contact the school district.
Okay.
And talk to the school district. I mean, certainly those are local.
I know.
In all of this, these are local decisions, and those are things that the district and the parent need to work
decide.
through. Yeah.
I don't want to get too crazy because we keep talking about the same thing, but people are saying if we're doing all these precautions, why do we think that there'll still be a second wave? Well, we're seeing what happened at the college.
Yes.
The 400 plus now probably going to be 500 or 600 kids that now are positive with COVID. Apparently, we're partying. You're neck and neck and shoulder to shoulder with each other. No masks. They have all documentation of it. You also, the numbers. If you see my daily report. We have people coming that are day workers. That was talked about today on the governor's call. A big outbreak in a couple of the counties, including one that straddles ours, where people are coming in here, and we've also talked about travel. So when we talk about the possibility of reducing a second wave by doing all these precautions at school, we still have outside risk. Doc?
Yes, absolutely. And the county executive makes a phenomenal point as far as what the current transmission looks like. But fundamentally, the reason why experts are concerned, some of it has to do with historical data that we already have and we've compiled over hundreds of years. Some of it has to do with global statistical trends. So globally, what we're seeing, the global picture right now, typically all flu-like illnesses follow the same pattern. They originate initially in Asia. They go on to Australia within a month or so. Then they follow the trajectory onto European Union and the UK, and then they end up in the Americas. This pandemic followed the same trajectory. Every flu season follows the same trajectory. That's why we kind of get the flu vaccine that's updated and tweaked based on what the UK strains and what we're seeing there. And global statistics have already really demonstrated that there is that second wave that hit China, and thankfully even Wuhan reopened schools with mandatory mask requirements. But currently, however, at the end of May, beginning of June, China did shut down majority of their provinces. 100 million people were under lockdown yet again for their second wave. Then about a month and a half later, on July 7th, we have seen Australia shut down. About a month and a half, which is right now, puts us in August, we are seeing some European Union nations, so France, Belgium, reporting potential for shutdown. Spain, they are seeing a resurgence of cases. So there is a global trajectory statistically that we are following, but also scientists, there is a historical presence for this, and there really is an underlying kind of trajectory that we're following. So since the 1700s, we won't get really far back, but I will just mention one fact. There have been 8 global pandemics, 4 of them since the 1900s, and 7 out of the 8, not including the H1N1 because that was kind of an outlier, have followed exactly the same epidemiological curve. So we just finished this initial curve, and typically they tend to follow exactly the same curve with that early peak that we were just through. Now we're in this trough, we're in this lull, and ironically, they coincided with the same months. And then after that, there is a substantial resurgence of cases within 6 months. So 7 out of the 8 global pandemics since the 1800s have followed exactly the same epidemiological curve. So a lot of it we can do quite a bit about, but that resurgence, that potential resurgence, as you could see, that secondary spike is a lot larger than that initial one. Despite this notion that there is herd immunity now, and there's in the absence of vaccination, pharmaceutical intervention, there has not been herd immunity, because even if you stick to the premise that 11,000 cases are not all of the cases and not the extent of the cases that we have seen, even if you take our population of 385,000 people and to say we didn't have 11,000 cases, let's say we had 20,000 cases, 30,000 cases, that's not even the tip of the iceberg as far as just our population alone. Majority of the population has not had COVID-19. So first of all, we don't know anything about long-term immunity and antibodies, circulating antibodies, and post-secondary exposure. So that herd immunity concept is out the window. And from what we have seen and the lack of vaccine pharmaceutical intervention, and with all of those unknown factors currently, there is the basic understanding that there may very well be a secondary wave, and that potential is expected anywhere at around October, November. So it is instrumental to follow safety precautions for prevention measures.
And one of the things that we comment on and we talk about a lot is that we compare. South Korea has less deaths than Orange County, and obviously thousands of times less than New York and the United States as a whole. South Korea has now seen a resurgence and is taking precautions. They've had a pretty heavy-handed to try to keep it down. Now, every answer you guys have had spurs other questions. So I'm going to do like some kind of, I'm going to try to go around. Bill Hecht, will every school have a nurse on premises?
That's certainly a good question. It's an individual. It's an individual answer. I can tell you that in terms of BOCES, we have nurses in each of our buildings. In fact, I think we've increased one in one of our buildings because they're only half time. But I go back to, I can't speak for an individual district, but that's certainly something that a parent can contact the district.
We mentioned earlier you're going to have school buses with windows open, and you're going to have classrooms with windows open. Monday, it turns into cooler weather right away. Are we going to have problems going into this? It keeps going back to this HVAC system.
Yeah, summer, winter, spring, fall, windows can be open. We've said that to staff, because certainly fresh air is really it really helps.
Right.
To no matter what, if you're outside, it's better for.
But now we're getting, I think what the parents are getting at, we're getting into cooler temperatures now.
Oh yeah, no,
we're going to keep windows cracked open and the heat cranked high.
Yes. In fact, New York City, I believe it was back in 100 years ago in the pandemic, ran the boilers extra hot because they wanted to keep the windows open to help with ventilation. So it seems like an old savage move. But that's really what worked.
It seems that we're reverting back to that with masking and other.
Well, absolutely, it's just like it.
So going back to, again, every parent that's listening here is paying attention and asking a lot of great questions.
They are great questions.
So Dr. Gelman's not in love with the thin gaiters or thin bandanas. Who's going to enforce that? The local schools? And they're going to come in and say, Johnny, your mask isn't adequate. Take one of these free ones provided by the district.
Here's the thing. We've talked about the gaiters, but the CDC only currently recommends against the masks with valves.
Yes.
So no governmental agency, as far as I know, has come out and said we don't recommend using gaiters or bandanas, right?
Correct.
And we've discussed it. We've seen the study that was done by, I forget which university it was, but they did, was it Duke? Okay, yeah, they did a study using lights and all kinds of things. So we don't want to make up any rules based on one study or somebody's opinion or whatever. We really want agencies who are in the business of advising on this to make the call and advise us. And that's what we actually just added the valve requirement to our reopening plan, which will be posted hopefully sometime tomorrow. A little update to it, but we just added that. So these documents are living, and as new information becomes available, we're adding that too.
So absolutely no face masks with valves of any sort, and absolutely no face shields to substitute for a mask. If you'd like to wear a face shield or some sort of eye gear, great, because mucous membranes obviously are not just the nasal passages in your mouth, but also your eyes. So you can wear eye gear, but just not to substitute for a mask. So no face shields alone without a mask, and no masks with valves. The gaiters and the bandanas, not ideal, but better than nothing, essentially, and even that with depending on material.
Let's just go through like a really quick speed dating round. Yes, no, if you guys know this. Are ventilation upgrades required in schools?
They're not.
They are not. Okay. The other questions are, let's just walk through very quickly. Hypothetically, my child goes to school and is now, it has symptoms, goes to the nurse's office. She's sick or he's sick. Doc, just walk them real quick through the procedures.
They're isolated, they're contacting the parent, and they are going home.
And what about Bill's kids and Mark's kids and your kids? You will be notified as a parent, this happened today?
Absolutely, and they're going home.
And that's part of our plan. That's
Absolutely.
what we do. We have an isolation room that we keep them separate from
But I
the
think he's
nurses.
asking about other kids in the room.
And other,
We don't have a positive.
People are just asking globally, like, how does the whole process happen? Like, if somebody's kid is sick, how am I going to know that my kid was exposed? And what do I need to do? Is my kid now going to have to quarantine because they sat in the same classroom?
And it will be case dependent, because a lot of these cases will have different permeations, and I refer all of the parents back to the FAQ document. It goes over so many scenarios and different permeations of it as far as travel-related household exposures, classroom exposures, buses. But generally speaking, yes, that individual that is symptomatic and actively, secretions or anything else, will be taken to the nurse's office or the healthcare provider, and then they will be isolated, sent home, so that parent is contacted. The rest of the classroom disinfected, closed, whatever the safety parameters actually indicate in accordance with CDC and other guidelines. All other individuals in that classroom, once that is a confirmed positive case, will be notified either individually by the health department and or in conjunction with the school notification that will take place. Or if this is something like a lunchroom setting or something that's a broader setting, playgrounds, outside, you may have an actual announcement either from the school or a public health advisory from the health department.
So I think we should all premise this, like 2/3 of the parents are nervous about this. Probably every parent is nervous about this.
I'm sure.
We're all nervous about it.
And a lot of us don't have, there's no concrete answers for a lot of things. Every
right.
school district has their own policies, but we kind of know an average, what it's going to look like and what the basic procedures are. There's all sorts of great specific questions. What are we doing with shared materials? Your kids using the same crayon box as mine or not?
We're discouraging.
We're discouraging.
It's discouraged. It's discouraging the guidance, and we discourage it.
And this is something we've addressed with all of the superintendents. I've been on multiple calls with individual superintendents, collective calls, and we've discussed that to no end. But I will remind, bus rides in classrooms, and this is really the premise and the baseline for actually mandating those masks with us here. It's a true and a primary means of prevention because bus rides in classrooms are more congregate settings than anything else. So general guidelines consider a congregate setting environment and a definition to be one, and we go through that proximal and direct contact, obviously less than 10 feet and for longer than 10 minutes. A classroom and a bus ride tends to be a more of a congregate environment because that duration and that proximity, it tends to linger longer. You're doing more activities, you're walking by, there's that possibility for dynamic transmission. So that's precisely why we are mandating those masks at all times to account for that potential for secretions and for actually having those droplets pass on.
Okay. Lot of parents from Cornwall still. Apparently, there's a petition to make some changes there. And I did talk to Kevin Hines, the county legislator over there. He said there was a lot of stuff going on there. Bill, you were saying? I'm sorry.
Nope.
Sorry.
Questions coming.
Okay. So there's all sorts of scenarios here. Somebody says that if somebody's kid has a fever and they're giving them Tylenol, are they going to be checked later on in the day if their fever spikes at school? Or are they going to be?
Yeah.
I think a piece of this. We talked about the parents being our partners. Responsible. I mean, that's the first line of defense for us, and we need to work together.
And you're not, Dr. Gelman, your daughter gets sick at school, God forbid, goes to the school nurse. They're not testing her for COVID there. They're calling you and having you go see your doctor.
Absolutely.
Yeah.
Okay.
Absolutely.
That's correct.
And now with virtual visits, it's a bit easier than typically to contact your provider. And if that child is well known or if that staff member obviously is a patient there, it's more of a streamlined process. And this is something we've discussed with the superintendents also. Thankfully, having our county executive being the visionary, we are working on a remote access platform for countywide. And hopefully we will make that available to the schools that would like it. And that would act as an extension of that virtual clinic for either those schools that do not have a nurse on staff immediately, or for the school districts that maybe share nurses. So that virtual clinic component may come in handy where you're able to dial into the parent, dial into their treating provider, and really streamline some of those processes. So we're working on that as well.
I got to tell you, in terms of the virtual clinic, that came in, it was essential when we were totally quarantined in March. I mean, there was no way you could go to your doctor, your physician, and a lot of your diagnoses and your doctor visits were online, virtual. So it was a lifesaver for many people.
Absolutely.
So let's spend some time, guys, just real, a big portion of our community. Can we speak about special needs, medically fragile, intellectually unable to understand, or that have severe autism with sensory concerns that can't wear masks? If they don't benefit from virtual and need in-person instruction as well as therapy, some schools are asking for medical provider notes.
That's correct.
To accept their students from wearing masks. Doctors are being told by their leadership that they can't write these. Can guidance be given by physicians in the area of these notes, or to physicians, sorry, so they can give these notes out there? Are we having those conversations with medical providers to say, look, you're going to get these requests from your patient or from your school district to write notes for students? Let's talk about that. What happened to them? Because we had a lot of parents during the last 7 months saying, this virtual stuff's not working for my kid.
Correct. That's correct.
But ultimately, we have to understand kind of the global perspective of this, and I definitely understand the plight of those parents and those individuals that are going through this, but we are speaking about a medically fragile individual, whether staff member or a student, that is already more susceptible and more vulnerable just by the definition of the term. And we really have to include the treating provider in that conversation, because it's not just up to the school, it's not just up to the provider of services, it's not just up to the local health department or the state health department to determine what the safety parameters would look like, because from a global perspective, we are still in the middle of a global pandemic. So this is the local impact to a global pandemic. There has to be a conversation with the medical and treating provider on how to keep that medically fragile individual safe when they are precluded from wearing a basic cautionary and a basic containment measure. So that's the first primary line of response. The safety measure, the first line of defense is that mask, both to the individual and to everyone around them. If you're removing that barrier because their medical condition or underlying etiology is precluding them from wearing it, that medical provider will be the only entity, as far as I understand, in my understanding of it, to really determine what the safety protocols would look like to keeping that individual safe from contracting COVID-19 from others, as well as from passing COVID-19 to other individuals around them. So that's a very important conversation to be had with the primary treating provider.
Can we walk through, we have Labor Day starting this weekend. Some schools have started, you guys have yours. Can we walk through what parents need to, let's take a deep breath. You said it's a journey. We're going to have to both all be on our A game here and be flexible, Mr. Hecht and Dr. Gelman and Mr. Coleman. What do we need to do to prepare? Doc, what are you doing
Please do
to prepare
not go
for your
to
kid?
parties. Please do not go to any congregate settings or parties and social issues, because right
Talking
now,
barbecues this weekend, getting too social.
bridal showers, birthday parties, barbecues, celebrations that are 3-day long, and then we'll be responsible for clusters. Please be responsible. If you're going
Every
out,
health commissioner is saying it. This weekend, 3-day weekend.
absolutely, and it has very long stemming consequences from that, because a lot of the clusters that you refer to as far as colleges, they are part and parcel, sort of an extension of a lot of those parties that happened early on, whether they're graduation related, whether they're related to moving into your dorm of your dreams, whether they're related to athletic or sports teams or parties or kids just getting to know each other on campus. You don't want to do that through COVID-19, and having a campus shut down, such as that school, that SUNY school that has been in the headlines today, which is the largest cluster that we currently have. That's a legitimate outbreak that now is impacting the rest of the not only surrounding areas but all other counties. So please.
But if you tell people to do nothing, they're not going to do that. But maybe if you have, like, let's say it's a long weekend, Bill Hecht is having Mark Coleman and his family over for a weekend, you bring your own food. Right? There are ways. There are ways of doing that.
So
I would
bring your
decline.
own
I would decline the invite, but that's
Stay safely, wear a mask, socially distance, obviously wash your hands, keep the groups very small, because majority of our current cases right now are still in that 18 to 44 category. A lot of them are travel related, and a lot of them are related specifically to that. And that's in the absence of this large Labor Day weekend right before school starts. We don't want to close our schools just because individuals just rampantly attended parties.
And the thing with that, with the parties at the colleges, there was a lot of physical contact, there was a lot of unmasking, there was a lot. So, as long as you follow the protocols, you wear your mask, you stay socially distanced.
6 feet apart.
avoid large gathering. It's true. It's true.
So, as we start, can somebody talk about? I had one question I didn't get to. What is the status with sports? Will kids be able to play sports this fall?
Yes, so thankfully there are updates to the New York State Department of Health pre-K through grade 12 guidance document out already as far as low and moderate risk sport, and they clarify that in that guidance document. So they have updated the current guidance document to reflect low and moderate risk sport, which they do identify tennis. There's a whole list and how they classify that, when it can start, timeline dates. Also, the New York State will have an entirely new guidance document available. They're promising before the end of the week. Otherwise, we are definitely having a Labor Day weekend call with the state, which I'm not looking forward to. But we will have an updated guidance document. Hopefully that will go into greater detail of that. But for the time being, they have clarified low and moderate risk sports.
I would share that this is a hot topic across the state in terms of when sports should begin. It's been on our superintendent's agendas over the last several weeks, and our superintendents would absolutely love our students to be playing athletics. It's something that they wish to happen. It's just a matter of when, and they are discussing it. The athletic directors are talking about it. They'll come out certainly sometime soon with a plan for sports and what that model looks like. But I can tell the parents certainly. It is on the, it's certainly one of the items on the top of the superintendent's list in terms of discussion. It's certainly something that we look forward to. It's something that we look forward to weekly in the fall. So, there will be information coming out probably within the next few weeks.
What would you say to parents who send their kids to school even if they're sick? That happens all the time. That's to BOCES, that's to you.
Please don't.
Yeah.
Please don't. We know that happens. We know it happens.
Like you have parents that are working, like a single mom.
I understand.
That'll send their kid to school sick.
It's a tough place to be. It's a tough place to be. I get it. My wife and I both work. We're struggling now with 4 kids who have to be home, schooled at home because our district is all virtual. I get it. But it's not worth it. It's not worth getting everybody sick.
And don't forget the disruptive nature of it, because it's beyond just personal responsibility. What will actually happen? We went through the scenario of what happens when a person is actively symptomatic. So even if you're giving them that Tylenol initially and you have that fever suppressed early on, within a couple of hours they will still spike a fever, or they will develop symptoms. What ends up happening is you're still going back to the nurse's office, you will be called, your day will be interrupted, you will be required to pick up that child all of a sudden in the middle of the day, disrupting everyone's day, and you will take them home. So please just keep them home to begin with so they can rest comfortably, get over whatever their condition is, and hopefully rejoin us when they're healthy and everyone is happy.
Well, because nobody's being fooled. Teachers are intuitive. Teachers are great. They're a lot of times they're moms and dads too.
Right.
And they're going to know as soon as that child starts to get the fever, they're not going to feel well. They're going to pick up on it. So that's exactly what's going to happen. A couple hours later, there's going to be the call, and the child now, if it's a COVID-related symptom, will be in an isolation room. So it's, they're pretty much an empty room with a cot in it, because it has to be disinfected. Then there's a whole procedure that happens now when you go to the isolation room. So it's just wise to keep them home, please. Parents need to really work with us. Staff needs to work with us. Everybody needs to do the right thing to keep this thing going.
Doctor, let's go to BOCES or Dr. Gelman. Are you guys satisfied with the individual school districts' plans on cleaning and sanitizing classrooms after each day?
To be honest, Steve, I didn't read all of the district's plans. I read some of them.
We have
17, 18 school districts in Orange County. I didn't read all the plans. We were busy making our own. I can only speak for us, and I know that we actually ramped up COVID cleaning, I will call it, when we held Odyssey of the Mind in, what was it, early March, was it?
Just before we closed down.
The cases didn't hit, but there were some concerned parents that there's a global pandemic coming and we shouldn't hold this event. And we literally had 1,000, 1,500, maybe more people in our buildings. And I don't think anybody got sick, which is great, but we really didn't have spread yet here. But people noticed, people commented during that event. We had people wiping door handles, constantly cleaning bathrooms, So I know we have increased that level of cleaning. We obtained the sanitization guns, the electrostatic sprayers.
Going back to the sick kid, if somebody does send their kid to school because they have no other choice, will that child be isolated?
Yes.
Yeah.
So as we mentioned, yes, but to your point, absolutely.
And that's per the guidance, Steve. That's-
And the parents have also increased kind of the level of personal responsibility to what the cleaning looks like for both the parents and the child and the family in general. Majority of the schools, actually all of the schools, are following the CDC cleaning guidelines as well as the New York State Department of Health guidelines for cleaning. And I have personally discussed this with all of the superintendents on the number of calls that we had, which my number one concern, and I've mentioned this over and over again, other than just masking and those standard social distancing and hand sanitizing protocols, has been the restroom scenario. So really going through the restroom scenario with a child, no hand air dryers, because think about that aerosolization potential. And that's something that I take great pride in discussing with the superintendents, because all superintendents have complied with that, and
So,
there are
Doc,
no
your
hand
child
dryers.
goes to the bathroom, in a
Yes.
children's bathroom. You're telling her or him not to use the air blow dryer?
Oh, well, they're not in use actually. In all schools.
What did they?
What we did is we took ours out of service. They're still
Yes.
physically there, but they're shut down, and we installed hands-free towel dispensers, which is part of the guidance.
Every
So-
school district's
Well,
gonna have
I can't
that.
speak for every school district, but it's a recommendation. I actually don't think it's strong enough in the guidance. I had to really look for it to find it, because we had discussed it, but that's what we did. I can't speak for every
But that's the
district.
point when that child is there in the restroom, they may remove their mask, they may be speaking with a friend, they may be vaping and doing other things that public health-wise were frowned upon, but ultimately they are there, there's that potential for transmission, and now all of a sudden you're taking their air dryer and aerosolizing
Yes.
particles. So that's something we discussed just on the basic principle of aerosolization, and again, before vents, before anything else. So there are a lot of steps before we get to ventilation and filtration issues.
And as Dr. Gelman stated, I mean, we've had those conversations with the superintendents weekly, and talked about ways to figure that out and how to do it, it's something that they've worked into their plans.
Just a couple quick things here. Keep moving on here. One of them is, I think about 60% of the students or more are going back, depending on each district, and the other third are going to stay, depending on each district.
It really depends. I mean, for us, it was about the social distancing in the classrooms. Many of the issues at the secondary level are the fact that you have classrooms that would house 25 students per period. Given the guidance, you can't do that. So that's why districts have had to go to an A schedule or a B schedule or a remote or a hybrid. There's certain restrictions that you've got to follow with regard to the guidance.
And we did that with our
Yeah.
CTEC classes,
Yeah.
the AB, but our special needs classes were typically smaller size. Anyway, they were perfect for social distancing.
Yeah.
They're typically 8 students maximum to a room, 6, 8, 12, whatever. But so that lent itself to be able to attend to that whole population just based on that small size.
So the state of New York has driven this process. Some parents are saying, could districts in Orange County do what New York City's doing and say, we're not ready yet, let's push it back?
Well, they have.
Okay.
The districts have.
Right.
It might not be the district they're talking about.
Right.
The other thing is, and again, I just want to make sure I get all these. I'm writing these questions down. Some parents that are home that are educating their kids at home or doing a virtual option are talking about social isolation. How can you help your kids doing it? One parent said they had one child in the school that's their only child, so they're home alone. They should in my experience is talk to your child's friend's mother and set up virtual play dates or whatever, things like that.
You got to find ways, whether it be social distancing outside the home. There's ways. I mean, we had to come up with ways to reach out to our students when we were totally remote.
Fishing's a good one, Steve. Steve's a big fisherman, and I know that my oldest son, we've gone with his friend. We belong to a hunting club, and actually we have a big pond, and we made an agreement with the parents that we're going to meet up. If you bring food, we'll bring food, and staying 50 feet apart. And that works.
Absolutely. We've done play dates too, where you stay on one side of the fence and you bring your own snacks.
You can still talk, you can still laugh, you can, communicate.
And that proceeds to the next question that keeps coming up. When will things go back to normal? And my personal opinion,
Dr. Gelman,
until there's a vaccine, I know there's some people that are not going to take the vaccine, but until people feel comfortable, and I talk about this every day in my briefings, the airline industry is shutting down in a month from now because people are not buying tickets because of this talk of a second wave. So things will not go back to normal until people get that confidence up. Doc?
So as far as vaccination, in order to reach that herd immunity status, we need to have over 60% immunity within the community, whether that's disease exposure or vaccination rate. So in order to have that 60%, we need to have obviously a higher rate of vaccination and exposure to disease. And that goes to that R0 value of 2 to 3 for every individual, 2 to 3 getting it. In terms of what was projected originally with this pandemic and with the local impact of the pandemic, the total duration of the pandemic was originally estimated at around 18 to 24 months. So that was that original estimate. Obviously, subtracting the time already spent in the midst of this and really combating it right now. So minus 6 months, that's essentially the original estimate for how long we can continue to see cases. Obviously, that can be shortened and mitigated by a number of factors, having pharmaceutical interventions, and I know remdesivir is in various trial phases as far as an antiviral or maybe other adequate antiviral medications, and vaccine, having an actual vaccine that is effective.
What about, these are great questions. Again, there's hundreds of them coming in here, guys. So what about students that don't have money for supplies for all these changes going on? Most districts making it work.
What kinds of supplies are we talking about?
I guess specialty supplies.
So if it's PPE.
If they don't have enough supplies or money, like, I guess obviously kids are coming into school differently this year than last year.
Certainly there's resources within the school and community. I can tell you that certainly through organizations within each of the communities, they provide, whether it be school materials or whatnot, school supplies for those students that may not necessarily be able to afford those kinds of things. So, reach out to the school districts. They may have additional resources. The schools may be providing some of those as well. So I think you need to just tap into the resources within the community, specifically the school. Contact the school.
I know a lot of school districts are providing laptop computers or basic masks and basic requirements.
And a lot of people are either nervous or not happy. So again, I would ask them to. We'll follow up on it. I'll get back to you, or I'll put some of my legislators to work with me. They'll help us find out, and we'll work with you. And obviously, the school district. Doc, follow-up question. A kid is sick, presumed or don't know has COVID. Are you not going to be notified as a parent unless they test positive, or are you going to be notified that says it appears somebody might have the symptoms?
So
that's a great question.
What triggers our notification as far as the local health department?
They want to know as a parent. Am I going to know that your kid went to the nurse's station with symptoms of COVID?
No, you're not going to know of any kid. Just like any other disease, that child may have had an exacerbation of asthma. They could have had asthma attack. We're not going to go into explaining why each individual staff member or child went to see the nurse. That's beyond HIPAA violation or anything else. That's just individual right.
But every day it says, oh my God, Susie Gelman went to the nurse's office. She looked like she had the flu. Like the kids come back with it. If they had. Right. And when are you going to find out that there's something that I need to be worried about with my child or his child?
So we respond to confirmed cases. So this will be a lab confirmed case. This will not be something where your child went to get antibody testing and we don't know at what point in the continuum they possibly had a disease, and we're not really reliant upon antibody testing to begin with.
And then there will be the contact tracing.
Yes.
Where we would notify those individuals who had been in contact with that individual.
Yes.
But it's only on a positive case. That's the point.
So
That's the point of the question.
Yes, there has to be a lab confirmed positive case, and that spurs on the communicable disease investigation, and that actually goes into the contact tracing.
And there's also talk, great. These are awesome, great questions here. Your kid going to get bullied now. They're going to have a stigma that they were sick or might have been sick.
And we've got to ensure that doesn't happen.
Absolutely.
I mean, that's part of our role. In all of this.
But that's precisely why I had mentioned, and this happened early on, right at the peak of the pandemic when the schools were still open and they were on the threshold of closing. We have never disclosed any contact information. We have never disclosed any name of any particular individual. As a matter of fact, we even protect the statistical data and the validity of that statistical data, where anything under a sample size of 10 is not even disclosed, just not to identify any individuals, as you and I have had this conversation at length.
Yeah.
Any individuals, let's say, residing in the same household, where, let's say, if Chester or Warwick or Pineborough has 2 to 3 individuals that have been identified as positive, and then they're all household members. We never even identify anything that's statistically a significant sample size. So absolutely none of that information will be released by the health department or the school. The parent rumor mill, unfortunately, that's one factor that we cannot really account for, especially with the advent of the internet and social media that can run rampant. But that's all speculation, and please keep in mind, as a parent, as a staff member, just because an individual went to a nurse's office or didn't feel well does not mean they actually had COVID. Just because they were out for 14 days or 10 days does not necessarily mean that they've had COVID. It means they may have traveled and they're doing their due diligence, they're taking this responsibly, they're being a responsible community member and actually isolating to protect themselves and everyone else around them. So stigma aside, there will never be a confirmation that person A, yes, had COVID-19, but whatever fuels the fire, I guess.
There's a lot of great questions here. Like, it takes, my husband just got tested, and it's going to take 3 days to get the results. The reason, well, that's why everybody's going to be wearing a mask in the classes, and when they're, that'll prevent them. So even if they were exposed,
Well, but
and going back to, if the test is pending, they will remain at home.
That's right. So
until they receive a
that's one of the
diagnosis.
screening questions that we ask. Have you been exposed in close proximity to a confirmed or suspected case of COVID-19? If they answer yes to that question, staff or students should not come to work or school that day. So that's covered in the questionnaire, which every school district, I believe, uses the same questionnaire because it was the Department of Health, I believe, made the questionnaire, State Department of Health, made the questionnaire, so everybody uses the same language.
And they cover the travel related, and they cover the COVID-19 screening, household members. And I would suggest that parents do familiarize themselves both with the New York State updated guidance as well as the FAQs, because they tend to we really go into a lot of very specific information and really data that will be important moving forward.
I know we're at past our time, but I'd like to keep going a little bit longer, guys, just because just want to answer a couple more questions.
It's important stuff, Steve.
How will a kid be treated in isolation, both at school and then when they're sent home? Let's say they're in isolation for 14 days. Will they instantly go on to now the remote learning program?
We'll need to provide, certainly some form of,
And who's going to be caring for them now? Now a parent. So Mark Coleman, in your case, you're working full time. Your wife's working full time. Your son or daughter now is suspected or comes down with the symptoms and is now in quarantine. You or your wife will be.
Well, we're going to be subject to quarantine as well.
Yeah.
Yes.
Yeah, because
that's the parent and
it's a household. So now the household is now quarantined. So it's a given. It's
but also I think the flip side of that question though is if we're seeing an increase in community-wide occurrence and that prevalence. So if those individuals do present in person and we continue business as usual, everyone will close. Everyone will have to stay home and take care of our children, and we're back to square one where we were at the beginning of the pandemic, with businesses not having staff and employees.
But I think a lot of parents are seeing this as that heading in that direction. I think that's what a lot of people's concern are right now. Or we're sending our kid back to school to now be back home with them, or one of us not going to be able to back to work. And unfortunately, there's a lot of people that don't have the means to stay.
Yeah.
But if that child is ill or symptomatic, unfortunately, that's a very realistic possibility where not only that child, but then again, the parent themselves who's exposed to that potentially symptomatic child is staying at home, yes.
But on the flip side, if we don't go back to school, then the children are still home.
I get it.
Yeah.
So
I mean, a lot of teachers are under a lot of pressure here. A couple teachers are commenting, like, how are we supposed to now be policing masks and educating at the same time?
Listen, my wife is a teacher, and she hasn't slept in a week. So I get it. I get it. I have sympathy for it. And it's really difficult because teachers are asked to do an awful lot. And
I know again, I'm going to continue to do random questions. I'm getting so many questions in here.
Fire away.
The buses, you're going to have to sit staggered seating.
So the
There's space, right?
bus layouts are spaced. Yep, they're spaced.
Unless you're part of the same household.
If you're part of the same household, you can always sit together, but you're spaced. Masks allow you to put more people on the bus if you don't have. But although the order now, which I'm surprised you didn't talk about, it's a wonderful order on masks. I'm so glad it came out, to be honest, and I'm very serious about that. But Dr. Gelman issued a commissioner's order, I think it was today, that came out on mask wearing and mandate, except in certain situations that they're worn on buses and in schools and things.
Right.
And I do have to say, to commend you on the order because it took a lot of the ambiguity out of the process. That's what we need.
And just going back, I've gotten a lot of follow-up questions on shields. You can wear a face shield, but you have to have a mask underneath it.
Yes, absolutely, absolutely. You cannot wear a face shield without a mask underneath, but you can absolutely wear a face shield with a mask underneath or some sort of protective eye gear because, again, mucous membranes, eyes are your mucous membranes.
So glasses,
yes, glasses are protective.
They are protective.
They are protective because you can inoculate your mucous membranes just by virtue of touching it or having those droplets contaminate your eyes.
Okay. Sanitizing desks. These are the great questions, and those are from district to district. But from your discussions with all the school districts,
we meet with the school districts. We meet weekly. BOCES brings the districts together and meets weekly. And I believe every district is doing that same process. We're wiping desks, we're sanitizing, using the sprayers. I know we certainly do it at BOCES. That's really important. Any high-touch surface. That it's being wiped down.
But we've talked about this, though, at our superintendent's meetings, where even just wipes, cleaning your own surface and taking care of your own space. That's just part of good etiquette and good,
Absolutely. And we're doing that outside of the school setting. So that school setting is not necessarily just an isolated environment that's in a vacuum and a void. If this is a good practice for our daily, and hopefully daily we are conducting the same activities as far as cleaning and the frequent disinfection. So the same would apply to your own personal space.
Well, that's another part of the guidance is that every cleaner now in a school is required to maintain a log. So we check these logs. We know they do their job, right? So we're not doubting that. But I believe that information could be used in part of your contact tracing to see how we've been sanitizing, was it disinfected, what is the prevalence or the potential of prevalence.
And where that employee was actually throughout the building, just in case they're positive.
And there you go. That's another reason. So they have a log to maintain also.
So the other thing is, I'm just reading through a lot of these comments here. People with respiratory issues, asthma, and things like that, they're going to be required to still wear this mask? So
that's up to the medical provider. And as I mentioned before, and actually the commissioner orders is quite explicit with regard to medical exemptions. And it basically says, that's the last paragraph of the order, that
and it also pertains to people with special needs.
Special needs or any other medical underlying etiology. So by definition of the term, again, going back to it, these are the more medically fragile, susceptible, more vulnerable individuals to COVID-19 and its complications. So the order states that the medically fragile individuals with special needs or underlying medical conditions requiring special accommodations, which, for example, actually says explicitly unable to wear a mask but will still present to school in person, may be more vulnerable and susceptible to COVID-19 and its complications. An outline of the special needs accommodations as well as the safety plan from the person's licensed primary care provider that includes safety measures to protect the medically fragile individual from possibly contracting COVID-19, as well as potentially transmitting COVID-19 to others in a congregate setting, must be on file with the school district prior to resumption of any in-person learning. So this is instrumental. This is fundamental to us moving forward with this. If that medical provider is writing that exemption, is writing that order, it has to be prescriptive beyond just defining what the limitations are. We have to identify as a medical provider what those special accommodations entail. And this is going back to kind of full circle to the beginning of our discussion.
And on file with the district is important because you can't hand it to the bus driver.
Right.
Be on file with the district prior
and they have to be able to make those accommodations because at times those accommodations may not be feasible or just possible.
I think we had some instances today where we had notes at the bus stop.
Yeah.
And we had to make sure that that documentation got to the school so that was on file.
They can process it and they can actually have those measures implemented.
There's so many different school districts with different rules. A lot of parents are saying we need more meetings with our school districts. Now, I know they were mandated to do, I think, 2 general ones and 1 with your teachers. So that should have happened or is happening.
Actually, more, I believe.
There was more than that.
Yeah.
Many of them went far beyond
the requirements. Okay.
They were doing these town hall meetings before that mandate even come out. For them
and hours and hours and hours. Some of them went on for hours and hours
Keep
and hours.
getting a lot of Cornwall parents, so obviously that's going to be a follow-up issue. A lot of questions about, let's go back to one with the isolation with the kid. They want to make sure that your child is suspected of being sick in school is going to be separated from my kids and everybody else's kid. Is that definitely is that in their plans, Dr. Gelman?
Yes, that's in the plan.
They'll be put in a separate room away from everybody else's kids.
Absolutely.
Okay.
Absolutely.
this is probably something that's going to be something between the school district.
Just as a follow-up to that too, it'll be a supervised, I mean, for the elementary
Yes.
levels, it's a supervised room, and
Yes.
not just, put in
Left there
there
alone.
and left there
That's
alone.
correct.
So,
Right.
So the other thing is, it keeps going back to single parents, and I know there's a ton of them out there. So if they can't come home or something like that, this is going to have to be some type of relationship between you guys, the school district, and my Department of Social Services.
Yeah,
to make sure that that mom or that dad has
This is not a one-way street either. I think it's important that that the parent talks to the school, the principal especially, and develops a relationship. And usually there is that relationship, but there's a lot of things that can be worked out. So it's really important that the parent doesn't hide from the school, because we're here to help. We're here to help and make sure that everybody's. That's our primary job, is to take care of children. So that's what.
So people said this: did the school district's plan get reviewed? Yes, they had to get reviewed and approved by the Department, New York State
Department of Health and Department of Education.
Department of Education. Some of them were rejected and had to be modified, so they weren't just rubber stamped.
That's correct.
Okay. We got about 1:45, and I know I've had you guys on here. A lot of Cornwall people here. Again, I'm going through two sets of lists of questions. Same thing with school buses. So I mean, I think we could probably start wrapping up.
okay.
I know. Well, some people keep asking, why do we keep talking about China, Korea, and Europe? And forget the Trump Biden stuff. We're doing that because we followed that wave coming over here.
For the flu and everything else.
We were
Absolutely.
talking about this preliminarily in December.
Yes.
I remember you bringing us up to health meetings to the county legislature. We then started watching what happened in Italy as it started coming here. So we have to do our due diligence and watch if it happens here.
And that's just one of the
Again.
underlying premises and one of the parameters we look to just to see the trajectory of the global statistics, because don't forget, a lot of the global statistics are indicative of the national, statewide, and local statistics that we're seeing here.
For us, it came through Europe. I mean, for New York, it came through, the airport.
And that's the typical transmission as far as even the flu. And this is something that we keep discussing. That is the typical trajectory of any flu-like illness. Asia, Australia, European Union, and the UK, and then the Americas here.
So-
That's very typical.
So, I mean, I don't want to get off topic too much. I mean, one thing now, this is our second wave. If this does happen, I've asked, like, the state of New York, are we doing the same protocol they did with the nursing homes and that whole protocol? Are we changing that now that we're going into the future? Let's talk about PPE, personal protective equipment for staff and teachers. Every teacher, every staff should have everything they need?
Well, most everybody comes with what they need from home, but we're obligated to provide it.
If they do
Period.
not.
If they don't have it,
And
yeah, so we
it's
do.
grading into that risk mitigation, and this is something that we were discussing before. Obviously, school nurses and any individual that's consistently exposed to someone who will be symptomatic obviously are receiving a different level of PPE because they will be continuously exposed. And don't forget, our staff members have continuously worked through this. So the entire duration of the pandemic, our Orange County Department of Health staff has worked endless, tireless days, and we weren't the only department, we weren't the only essential workers to do that. So now that a very large portion of the workforce is kind of joining the rest of the essential staff and first responders, kind of in the reopening efforts and getting back to some degree of normalcy here.
Okay.
And Steve, I should make mention, and thank you on behalf of all the school districts. Steve made sure that PPE was distributed even up until a couple of weeks ago. BOCES was coming here to the EOC to pick up stuff, the PPE that was distributed to all the school districts for use by staff and students. So some of that PPE that's out there is because of whatever you did to get that stuff, and we got it out to the districts on your behalf. So thank you.
Okay, I keep getting a ton of questions from Cornwall, so we're going to have to do some type of follow-up, maybe some type of Zoom meeting or special thing. We'll talk to the school district, Bill, if you don't mind, tomorrow with me.
I mean, that's what I would suggest. I mean, certainly parents.
And the parents are reaching out to me as well, so they're all saying they need help. So we're going to have to figure out what's going on there and if there's what I can do to help them. We talked about face shields. I think we've questioned. Let me just see if I have any more follow-ups here. Okay. Yep. Everybody's watching this, even the district attorney's watching this as well.
Wow.
Are children expected
Good
to
show.
wear masks in PE, physical education?
Yeah, so children will be wearing masks. However, the order, again, and I suggest you do familiarize yourself with that order. It does it makes it very clear that there are a number of individuals that can determine when those allotted mask breaks take place. So as far as physical education, I know a lot of the schools are not restarting right off the bat that classic physical education component. If they're just walking around the track with their friends and they're conversing and they happen to be in PE class, obviously they will be wearing that mask to contain those droplets to really mitigate the potential for spread. If their physical education instructor and teacher, and they are explicitly mentioned in the order, believes that their type of exercise will be exerting that individual, and that individual at the point of exertion will not be able to tolerate that mask during the exercise, they have to ensure that they're in a very well ventilated area, hopefully outside. They're spaced apart at least 12 feet, which is double of what they're supposed to be. And then they can remove that mask for the purposes of rigorous exercise. So there's a big distinction between physical education class just at baseline because we're walking around, but we happen to be in PE class, versus actual rigorous exercise that they may be exerting.
What we're going to do too, because there's a lot of awesome questions here. I mean, people comparing West Point's, and I know those protocols are different too. So I'm going to try to, I know we probably have like 500 questions already here in the queue. Yeah, 540
and
questions.
I think it's a testament to how seriously we take the health and safety of our children collectively, all of us.
Well, I think as a parent, I'm the county executive. I'm confused. Everyone is a little bit different.
Sure.
It is scary. You hear doctors like you and every doctor is saying the same thing you are, Dr. Fauci and the state commissioner, and then you have all these different procedures coming down. So it is very daunting for parents. I also feel bad for the teachers. I know what my teachers have done for my kids, and it is a tough job right now.
But I look at what the superintendents are dealing with, and you know, every other day something's changing with regard to the guidance.
And there's a tremendous amount of work that has gone into preparing for this, and this is during the worst public health crisis in a century that we've had. So I think this is something that we all collectively share.
So here's what we'll do. For people watching, if you have questions, I'll do FAQs and I'll post it online, and it might be a living document. So as some people are coming online, asking some really good stuff here. The second thing is, when this thing first happened, the pandemic, the biggest thing was people filing for unemployment. So we put extra staff on helping people get linked up with unemployment. If you guys have questions, whether it's Cornwall School District or any of the other school districts in the county, you're not satisfied or you need us to advocate for you or you're not sure, message me and we'll get you back. We'll get you an answer. You'll have somebody address it, myself or one of my staff, and we'll try to start addressing it. Now, some spots seem like they need more TLC, like Cornwall. So,
and we'll help you with the FAQs. Whatever you need, we'll help you and Dr. Gelman.
And I know, again, this is very daunting for parents. Everybody's got their different scenarios. I'm going in a different direction than Dr. Gelman is with her family. But let's just go around the room. Mark, we'll start with you since we started with Doc and I first. Any last minute questions or answers?
Now, listen, I think the parents had a lot of great questions, and they're no different than the questions I have or anybody who has kids have. We're all nervous, but we're following the guidance. We know we're doing the right thing at this point based on the evidence we have and the data we have. So we're all in this together. We all want our children to be healthy and safe, and we as the trustees of your children when they're with us, we want the same thing for them. So, and I believe that's true of everybody in every school district, especially, I can only speak for BOCES, but, and Dr. Gelman said a lot of work has gone into this. We didn't open today because we started working on it last week. We've been working on this since we closed in March. We have met every day, weekends, and I'm not looking for sympathy, but the bottom line is this didn't happen in a vacuum. It didn't happen in a week. It started the day the schools closed. Absolutely. Back in March. So we are ready. A lot of the schools are ready, whether they be hybrid or virtual or in person. They are ready to welcome your children back, and we were just so pleased today to see the kids come back. So.
Right, and I would say that the districts, the superintendents, their administrators, their staffs, they've put their heart and soul into these plans coming back, and including one of the schools that we mentioned this evening. I mean, they've gone through everything that we've gone through from the point that we closed back in March, to close their buildings. This is a priority for all of us, and I can tell you that the superintendents, the directors of operations, the central office administration, the nurses, the teachers, the support staff, I'm sure they've lose sleep over all this, and it's a different world that we're living in right now. But we have to continue. We have to bring our kids back. We have to have that physical contact with them, that social contact with them in terms of instruction. So it's imperative that we follow the guidelines, we follow the rules, we use our masks, we follow social distancing, and it comes down to doing the best we can for our communities and our children. And you said it before, we're going to have cases, but there won't be the cases that we had in the past because we're following these guidelines. Hopefully.
So what we have learned throughout this crisis is that it's not about making the risk an absolute zero, because that can't happen. But it is about understanding it so we can manage it responsibly and so we can manage it better collectively.
So one thing I want to just put out. So if you don't want to message me on Facebook, another efficient way to do it is to email me. So if you email CE Office, so that's Charlie, Echo, Oscar, Foxtrot, Indigo, Charlie, Echo at orangecounty.gov.com.
It's India.
And whatever, we say it's a Navy thing. So look, CE Office at orangecounty.gov.com. We're going to post it underneath here, and we're going to get back to you on it. So Mark, him and I went to Marist College together, as well as Bill Hecht, thank you for being here. Dr. Gelman, always, we talk 50 times a day since this thing has started. There are a lot of great questions. A lot of them have come back up again. I will try to consolidate them in a FAQ, and we might be doing a TLC in one of the districts. It seems like that way. So thank you for joining us tonight. No, it's not easy stuff, and we're just going to keep pressing forward. We're definitely going to get through this together, and I hope you guys enjoy your weekend, and I look forward to continue to work with you. Thank you.
Thank you.
Take care.